Brexit deal that this House has just passed with a very significant majority has will help us to strengthen this yet further. I want to thank the National Institute for Health Research, the UK Vaccines Network, the Vaccines Task Force, AstraZeneca, of course, and Oxford University, and all the volunteers who stepped up for science and took part in the trial, and all those who've been involved in making this happen. From the beginning, we've focused on the vaccine as a way out of this pandemic, and now it is a reality. We need to vaccinate as quickly as supply allows, following the necessary safety checks, of course, and the NHS stands ready to accelerate deployment at scale from Monday, the 4th of January. We have a total of 100 million doses on order, which combined with the Pfizer vaccine is enough to vaccinate every adult in the UK with both doses. And we will of course vaccinate according to the JCVI priority, but today's news means that everyone who wants one can get a vaccine. We already have 530,000 doses available to the UK from Monday, with millions due from AstraZeneca by the beginning of February. Mr. Speaker, the clinical advice is that the Oxford vaccine is best deployed as 2 doses up to 12 weeks apart. And the great news is people get protection after the first dose. This means we can accelerate the speed at which we can vaccinate people for the first 12 weeks before we return to deliver the second doses for that longer-term protection. It brings forward the day on which we can lift the restrictions that no one in this House wants to see any longer than are absolutely necessary. Yeah. But, Mr. Speaker, we must act to suppress the virus now, not least because the new variant makes the time between now and then even more difficult. And so, whilst we have the good news of the vaccine today, we also have to take some difficult decisions. The NHS is under very significant pressure. There are over 21,000 people in hospital with coronavirus right now, and we can see the impact that this is having. The threat to life from this virus is real, and the pressures on the NHS are real too. I want to put on the record my thanks to all those working right now in the NHS, and in particular those, including our Chief Medical Officer, who've been working selflessly on the wards over Christmas. They deserve our thanks and gratitude and support, and we owe it to them to fulfil our responsibility to keep the virus under control. Sharply rising cases and the hospitalisations that follow demonstrate the need to act where the virus is spreading. And you'll have seen, Mr. Speaker, that yesterday alone, 53,135 new cases were registered, the majority of which are believed to be the new variant. Unfortunately, this new variant is now spreading across most of England, and cases are doubling fast. It is therefore necessary to apply Tier 4 measures to a wider area, including the remaining parts of the South East, as well as large parts of the Midlands, the North West, the North East, and the South West. And I've laid a comprehensive list in the Library of the House and published on gov.uk. Even in most areas not moving into Tier 4, cases are rising too, and it's therefore necessary to apply Tier 3 measures more broadly too, including in Liverpool and North Yorkshire. The rest of Yorkshire remains in Tier 3. These changes will take effect from 1 minute past midnight tomorrow morning. The new variant means that 3/4 of the population are now going to be in Tier 4, and almost all of the country in Tiers 3 and 4. And I know that Tiers 3 and 4 measures place a significant burden on people, and especially on businesses affected. But I'm afraid it's absolutely necessary because of the number of cases that we've seen. But where we're still able to give places greater freedoms, we will continue to do so. Mr. Speaker, today is a day really of mixed emotions. The joy that we have in the vaccine giving us a route out of this pandemic, the pride that Britain is the first country in the world once again to approve this British vaccine, the sorrow at the deaths and the suffering that the virus has caused, and of determination that we must all stick at it during the difficult winter weeks ahead. We end 2020 still with great challenges, but also with great hope and confidence that in 2021 we have a brighter future ahead. And I commend this statement to the House.
We now come to the Shadow Secretary of State, Jonathan Ashworth.
Thank you, Mr Speaker, and as always, I thank the Secretary of State for advance sight of his statement, and I totally understand why he's had to come to the House this afternoon to move further areas into tiers 3 and 4. I mean, we are, as he says, almost the whole of England is now in a form of lockdown, and for my constituents in Leicester, and I'm sure the constituents of honourable members from Greater Manchester will be deeply worried that our areas have now been in a form of restrictions for months and months and months. It's having a huge impact on families and small businesses in cities like Leicester, and I'm sure for areas in Greater Manchester as well. He's also moved Liverpool into Tier 3. Liverpool was the great success story. So is it his view now that the mass lateral flow testing is not enough to contain the spread of this virus? And our constituents will be asking how long he expects these lockdowns to be in place. We will vote for the regulations tonight because the situation we are in is truly horrific. As he has outlined, the virus is out of control. Yesterday, over 47,000 cases reported in England. In the last 2 weeks, nearly 500,000 cases reported. In England, there are now more patients in hospital, over 20,000, than at any time in this pandemic, with admissions rising day by day, including almost 2,000 on Christmas Day. Hospitals are close to or at surge capacity. We see ambulances queuing up outside hospitals because there are not enough beds for patients. We have London hospitals requesting to transfer patients in need of intensive care to Yorkshire. Frontline healthcare workers warn of oxygen supplies running low. So can he assure us there will be no disruption in oxygen supplies through this second wave? Our NHS staff are exhausted, morale is low, staff absence is said to be double its normal level, leave for many is cancelled. And this time there is no evening applause on our streets, just long, dark, hard nights for our NHS staff. The Nightingales were opened at great expense and fanfare, but now we hear that some of them, such as London's, have been emptied. Will they be used? And if so, given the staff shortages we know that there are across the NHS, how will they be staffed? There are reports today that only 1 in 8 retired NHS staff, just 5,000 out of an eligible 30,000 who applied, have been brought back to help. Shouldn't we be making full use of this resource, especially to help with vaccination? Today's AstraZeneca news is indeed a tremendous boost, and I congratulate all involved. But can he confirm how many doses we currently have today ready to go? Because we are in a crisis now. Mass vaccination needs to start straight away. We need to go hell for leather to get these jabs rolled out with no delay. We've already lost more than 600 healthcare workers to this horrific virus, including a disproportionate number of Black, Asian, minority ethnic staff. Frontline NHS staff need the protection of the vaccine ASAP. Will he set a clear target for when all NHS frontline staff will receive the life-saving jab? And can he tell us when all care home residents and staff will be vaccinated? And he will recall that I raised with him the situation facing those with terminal illness. Can he clarify what the JCVI's guidance is for that group today? This is a race against time, because the more the virus circulates, the more opportunities it has for further variants to emerge. The new B117 variant is 56% more transmissible. It's the dominant strain in London, the South East and the East of England. The nerve tag minutes from 18th of December suggest it could add at least 0.4 to the R. Given the first lockdown brought R to about 0.6 and the second lockdown to about 0.8, this surely means it will be harder to bring infections under control, and so harder measures will be needed. So will he publish in real time the advice he is receiving from SAGE on the restrictions needed? This is a global crisis, but let us be clear, this is a national emergency. Our National Health Service is becoming overwhelmed. I hope the Tier 4 restrictions are enough, but many believe even tougher restrictions are now inevitable. Does he agree? We need not put more lives in jeopardy when vaccines are so near. Let's give the achievements of our scientists the best chance to save lives. The country has sacrificed so much in 2020. Let's not repeat the same mistakes. We must start 2021 by doing everything it takes right now to save lives and support our NHS. Only then can we look forward with confidence and hope.
Secretary of State.
Thank you very much, Mr. Speaker. Well, he's quite right that there are problems with the challenges thrown up by this virus right around the world, and we're seeing some of the news from other parts of Europe today in terms of the impact in other countries. But he's also right that thanks to the approval of this vaccine, alongside the Pfizer-BioNTech vaccine, the end is in sight. And that should give us hope that whilst we have difficult weeks ahead of us, we also can see the route out of this pandemic and to normal life returning with all that that means and entails. He talked about the pressures on the NHS, and there are significant pressures on the NHS. One of the advantages of having a national health system is that when one area of the country faces particular challenges, then others can come to its mutual aid. And this is in process, it is happening, and it does mean that people are sometimes being taken across the country to receive care where there is spare capacity. That is necessary, and that is how the system works when it's under significant pressure. He asked about the vaccination of NHS staff, and I can confirm that thanks to the decision today announced by the regulator, we will be able to accelerate the vaccination of NHS staff who are already in priority group 2, as well as, of course, the over 80s and the care home residents and staff. He asked about the number of vaccines we have available, Mr. Speaker, which I mentioned in the statement. We have 530,000 across the UK that are available for deployment in the first week of January. And the NHS is doing a fantastic job of constantly increasing and expanding the scale of its operation. And finally, he asked about what more could be done in the areas where rates are very high and continuing to rise. And the true answer to that, Mr. Speaker, is that it is on all of us, and it's about how everybody behaves. Because if we collectively decide to stop this by taking personal responsibility and not coming into contact with others unless it's absolutely necessary, that is how we can slow the spread of this virus within, of course, the tiers restrictions which are necessary, but ultimately it's about how we all behave. That's how we're going to get through the next few weeks together, and then the vaccine can come and save us.
Let's head to Surrey with the Chair of the Select Committee, Jeremy Hunt. Jeremy.
Thank you, Mr. Speaker. The news from AstraZeneca is fantastic, and he and indeed British science in general deserves enormous credit. But the NHS now is busier than it was last April. In parts of London, it looks like it may fall over. But back in April, schools were shut. Next week, primary schools are due to reopen. In September, we came to regret allowing university students to go back en masse, but some universities are going to start to go back from next week. Why, in the middle of winter, when the NHS is under such pressure, when we have a dangerous new strain of the virus, are we taking such huge risks? Shouldn't our entire focus for the next 8 to 12 weeks be on saving lives, getting the first dose of the vaccine out to every single vulnerable person, stopping the NHS collapsing, and putting NHS frontline staff at the front of the queue for the vaccines so that we keep safe the people upon whom our safety depends?
Just before you, can I just remind members who are not in the chamber that they should have the same dress code, even though they are virtual. It is only fair that we treat each other with the same respect. Secretary of State.
Thank you very much, Mr. Speaker. Well, I share my right honourable friend's desire and strategy of keeping this virus suppressed whilst we get the vaccine rolled out as fast as possible. And one of the other good pieces of news from this morning's announcement is that we can roll this vaccine out faster because we only need to give the second dose after 12 weeks. It means we can get the vaccine into more people, the first dose, which the data shows gives that immunity, which means that we can get through the protection of the nation faster than we previously could have done. On the points he raises about education, Of course, these are important points. The Education Secretary is setting out in a statement shortly the details of how we're going to manage the very difficult balance between needing to keep children in education as much as possible, whilst also ensuring that we don't add upward pressure on the R and we don't spread the virus any further. I commend to him the Education Secretary's statement.
Let's head up to Scotland with the SNP spokesperson, Dr. Philippa Whitford. Dr. Whitford.
Thank you very much, Mr. Speaker. As chair of the all-party group on vaccination, I absolutely welcome authorisation of the AstraZeneca vaccine. Storage in normal fridges will make it much easier to deliver here, but particularly in low and middle income countries, which would have struggled to maintain the cold chain at minus 70 degrees as required for the Pfizer vaccine. But delivering the vaccine will still be a Herculean task for all 4 UK health services, and they will struggle if they are also dealing with surging COVID cases. Hospitals in London and the South East are already reporting shortages of critical care beds and even oxygen. So there's an urgent need to get the new variant under control. Does the Secretary of State recognise that when dealing with a spreading infection, getting ahead of it is critical? Only taking action once cases in an area are soaring is simply too late to bring it under control. All 3 devolved nations are already under level 4 restrictions to try and prevent the new variant getting a grip and getting out of control. So with greater levels of the new variant in England, and as he just stated, cases rising everywhere, does the Secretary of State not think it's also time to put the whole of England under tightened Tier 4 restrictions?
Thank you very much, Madam Deputy Speaker. Well, I have just announced the need to move a significant proportion of England into Tier 4 restrictions, and I welcome the implicit support for that measure, but also where it is possible to keep some of the freedoms that we all cherish, then I think we should. And that's the basis of the tiered approach that we're taking. I, of course, welcome her support for the rollout of the Oxford AstraZeneca vaccine. This will happen right across the UK from Monday, and it's been a pleasure working with Jean Freeman, the SNP government's health spokesman, cabinet secretary in Edinburgh, in Holyrood, to make sure that this vaccine that has been bought and developed and supported so effectively by UK science and right across the country, that it can be deployed properly to everybody in the whole UK on a fair and equitable basis according to their clinical need. I'm looking forward to working very hard to make sure that happens.
Let's head to Stroud with Siobhan Bailey. Siobhan Bailey.
Thank you, Mr. Speaker. There will be many businesses in Gloucestershire that are gutted to be placed in Tier 4, and it makes the rollout of the vaccine even more important. But there is a worrying increase of anti-vax information in Stroud. It's causing a lot of distress and upset for local people, and it's appalling that our Gloucestershire Hospital Trust had to spend their precious time during this pandemic defending themselves against films on social media that were wrongly claiming the hospital is empty. Will the Secretary of State assist me to reassure Stroud about the vaccines and encourage people not to share COVID information from unofficial sources to stop this dangerous, damaging and disrespectful behaviour?
Yes, Mr. Speaker, I strongly agree with my honourable friend who speaks very powerfully about the need for the proper authorised information about these vaccines which save lives. And we've been very careful to ensure that the independent regulator makes the decision on how these vaccines should be deployed, indeed whether they should be deployed, and they are confident in their safety and their efficacy. And it is that information and all of the information that is set out by the NHS that people should look to if they've got questions, if they want to know how and why the vaccine works, and who it should be used for. And I pay tribute to all those who work in the hospitals of Gloucestershire. It is hard work at the moment in the NHS. Rates of coronavirus in Gloucestershire over the last just 2 or 3 weeks have really shot up. And unfortunately, that's why we've had to take the action that we have on restrictions. But I want to thank all of the NHS for doing all the work that they have been doing over Christmas and will have to do over the weeks ahead.
Let's head to Twickenham with Munira Wilson. Munira Wilson.
Thank you very much, Mr. Speaker. And can I also start by welcoming the fantastic news about the Oxford AstraZeneca vaccine and congratulate all those involved. Mr. Speaker, I found it frankly shocking that the Secretary of State's statement made barely any reference to the immense pressures our hospitals are facing on the ground and what the plan is to help them with this situation. Major incidents have been declared in Essex and London. Ambulances are queuing outside hospitals. ICU patients are being transferred across country. The Nightingale hospitals were meant to be the insurance policy, but we hear that only 28 COVID patients are in the Nightingale hospitals across England. So if now is not the time to use the Nightingales, when is? And if there are insufficient staff, why on earth did the Secretary of State spend £220 million building Nightingales? What is the backup plan?
So State.
Thank you very much, Mr. Speaker. I'm not sure that the Honourable Lady was listening when I said in my statement that the NHS is under very significant pressure. And of course, we're working hard to ensure that that pressure is alleviated as much as possible. Over the summer, we have built significant extra capacity into the critical care facilities of the NHS, including across London. Of course, the Nightingale hospitals are there, as she puts it, as an insurance policy. They're there as backup. The London Nightingale Hospital is there on standby as backup. I've seen some stories circulating saying it's been decommissioned. Those stories are wrong. But it is better for people if they're treated inside a hospital. But of course, the Nightingales are there for extra support should it be needed. And this will require changes to working patterns of staff if we do need to if we do need to have patients in the Nightingales once more. But it is crucial, in my view, that we have those Nightingales there, ready, in case we need them.
Thank you, Mr. Speaker. I can confirm to my right honourable friend that Essex has declared a major incident, and can I also inform him that at this very moment they are submitting a request for military assistance to the civil authority, a MACA request, to assist with the construction of community hospitals, additional hospital capacity, and supported by the armed forces and partly staffed by the armed forces. They would also like armed forces help with the rollout of the vaccine, to accelerate that in Essex, and to assist with testing in schools. And could I ask him to look into the German BioNTech test as an alternative to the lateral flow test, which is as reliable as the PCR test and turns around in 1 hour?
State.
Thank you very much. I'll absolutely look into and get back to my right honourable friend about the BioNTech test. Of course, but BioNTech are an absolutely fabulous pharmaceutical company, as the whole House knows. What he says about the pressures in Essex is very significant and it's important. Of course, I'll look favourably on any request for military assistance, working closely with my right honourable friend, the Defence Secretary, who has been incredibly supportive, as have the whole armed forces during this whole year. They've done so much. They are already involved in the rollout of testing, as my right honourable friend knows, and we draw on the ingenuity and the reserve and the sheer manpower of the armed forces when we need them. And I'm very, very grateful for my right honourable friend's support for the work that we all need to do in Essex to support the NHS there and to try to get the number of cases down.
Jim Chapman.
Thank you, Mr. Speaker. Can I first of all thank the Secretary of State, as always, for his good news on the TV this morning. And at this time of the year, I think it's given every one of us a skip in our step, and to know that the vaccine can be delivered. Can the Secretary of State confirm the discussions that have taken place with devolved UK administrations with regards to the rollout of the vaccine, the timescale for completion of that, the approach to education and business production to ensure that a UK-wide lens with regional approaches is possible while still ensuring that the message remains: we can save lives and the economies if we simply do the right thing.
Yes, absolutely. Mr. Speaker, this is a UK vaccine that is being deployed across the UK fairly according to clinical need. And I spoke to my opposite number in Northern Ireland this morning, and I can confirm that across Northern Ireland, the rollout of the Oxford vaccine will start on Monday, the 4th of January, as with the rest of the United Kingdom, of course. We can't give timelines on when any rollout will be completed because it does depend on the delivery schedule, the manufacturing schedule of the vaccine. But the good news is that we have on order enough approved vaccines now to ensure that every adult who wants one can have the vaccine, and that is true right across Northern Ireland and the whole of Great Britain.
Let's head to Rushcliffe with Ruth Edwards. Ruth Edwards.
Thank you, Mr. Speaker. This is a bittersweet day for us here in Rushcliffe. We have the great news of the Oxford AstraZeneca vaccine approval, for which I congratulate my right honourable friend and everyone involved. But we are confronted with the depressing reality of going into Tier 4. Could my right honourable friend tell me when the new vaccine will start to be administered to my constituents in Rushcliffe? And will the easier handling requirements enable the rollout to be sped up so that we can start to get back to normal as quickly as possible?
Yes, Mr. Speaker, my honourable friend captures my emotions as well, and I'm sure the emotions of most of the House, which is that we have this new hope of a vaccine, but we also have some very difficult weeks between now and when it is rolled out to protect the most vulnerable. The extension of the time interval needed between the two doses from around 3 or 4 weeks to 12 weeks means that we will be able to inoculate more people with the first dose, and the news that the first dose is effective in protecting people is very good news, because it means that we can speed up that rollout and we can all get out of this situation faster than we otherwise would have been able to, and we can save more lives along the way. So that is good news, but I absolutely appreciate my honourable friends' emotional turmoil, because it is also tough, especially across Nottinghamshire and the other places that have had to go into Tier 4. And the message is really clear, which is help is on its way. It is here in the form of the vaccine, but we've got to get through the next few months with the minimum pressure on the NHS and keeping the virus under control until then.
Let's head to Hampstead with Tulip Sadiq. Tulip Sadiq.
Thank you, Mr. Speaker. Yesterday, the government announced that 1,500 armed forces personnel are being deployed to help secondary schools and colleges roll out mass testing. I'm sure the Secretary of State is aware that there are over 3,000 secondary schools and colleges in England. This means that schools will get the support of less than half a soldier each. So could I ask the Secretary of State, what specific tasks this armed forces will be carrying out, and if the government will commit to giving overstretched head teachers and school staff more resources for this huge operation that they're expected to carry out?
Yes, there's of course support for the testing of school children, and I'm sure that my right honourable friend, the Education Secretary, will be happy to set out more details in his statement shortly. And absolutely, armed forces support, especially from those who have experience of mass testing rollout so far, that will be incredibly helpful. But it isn't the only thing that will help this rollout of mass testing in schools. And I'm really, really grateful to the schools that have been involved so far, with the enthusiasm they've shown and the extra effort that they've put in to make this work. And I look forward to seeing that happen across much more of the country.
Hancock. Thank you, Mr. Speaker. The Secretary of State, in his announcement, has effectively locked down most of England, and on a previous interview with Andrew Marr, said that that's the place they would be staying effectively until the vaccines are rolled out. So can I ask him a question about the excellent news we had this morning about the AstraZeneca vaccine? The chief executive of that company said they could produce up to 2 million doses a week if the government's ambitious schedule for rolling it out matched that. Can I ask him to match that so that we can get everyone over 65 which is nearly 90% of the risk of death and hospitalisation, done in 7 weeks by the 3rd week of February, and then remove those restrictions. Every focus of government now has to be focused on that task. It is the central overriding task of the government, and can I ask him to say that the government is up to doing that?
Secretary of State.
Mr. Speaker, I am absolutely delighted to be able to agree with every single word that my right honourable friend just said. And he and I have not always agreed on every dot and cross of the policy on how to handle this pandemic. But on how we get out of it from here, it sounds like we are aligned, which is that we need to roll out this vaccine as fast as possible. The NHS can deliver at the pace that he mentions if we can get the manufacturing up to that speed as well. And of course, we're working with AstraZeneca to make that happen. And I was on the radio at the same time as the Chief Executive this morning, and I was delighted to hear his commitments. They have worked so hard, AstraZeneca, to make this happen. And then, crucially, we have to protect the most vulnerable. The fact that only 1 dose is needed to give that protection is incredibly helpful. And that way, we can get rid of these blasted restrictions as soon as possible.
Let's go to the MP for North Durham, Kevin Jones. Kevin Jones.
Thank you, Mr. Speaker. It's very welcome news that the Oxford AstraZeneca vaccine has been approved. But many of my elderly North Durham constituents, such as Joyce Ridley, a 94-year-old from Tanfield, who contacted me yesterday, are still waiting for their vaccine. The government promised before Christmas that it would prioritise 80-plussers to get the vaccine. So can I ask the Secretary of State, as I did in his statement before Christmas, when my elderly residents in North Durham will receive this vaccine? And can I say to the Secretary of State, I do not want a spin or a flannel answer. A straight answer will do. And if he doesn't know the answer, could he at least write to me so I can reassure those people who are worried that they're being forgotten?
Secretary of State.
Mr. Speaker, I will absolutely arrange a meeting between the Vaccines Rollout Minister and the Honourable Gentleman to look into this case in particular. Around 7 in 10 of the vaccines deployed so far have gone to those over 80. The rest have gone to NHS staff and to care home staff and to some residents in older persons' care homes who are under the age of 80. And so we are managing to deploy the vaccine right now, the Pfizer jab, to older people. What we have to do is, of course, do that as fast as possible and make sure where there are much needed cases like the one he raises, that we get that sorted.
Let's head up to Lancashire with Mark Menzies. Mark Menzies.
Mr. Speaker, can I just begin by joining the Secretary of State and thanking those in the NHS for the work they're doing at this incredible time, but also recognise that the Secretary of State has never failed and never shirked from taking really tough decisions, and that has no doubt saved lives. Mr. Speaker, in Fylde, I've got many care homes, but a lot of small care homes, family run, and lots of homes of assisted living. Can the Secretary of State assure me that work is being done to ensure that we can get the vaccine into those small care homes very quickly and speedily in the coming weeks?
Secretary of State.
Yes, absolutely. And my honourable friend is kind in what he says, and I'm grateful to him and to his support for the approach that we've taken throughout this pandemic. I really appreciate it. And it is precisely as he says, in order to save lives, that we've taken the actions that we have. The smaller care homes have been harder to get the Pfizer jab to because of the -70 storage requirements. That is much easier with the AstraZeneca vaccine, and the NHS has written out to GPs who are running the vaccines programme today to stress the importance of getting to care home residents as staff as soon as possible.
Let's head to Nottingham with Lillian Greenwood. Lillian Greenwood.
Thank you, Mr. Speaker. The news of the Oxford vaccine is very welcome, but from tomorrow, my constituents will face further very difficult Tier 4 restrictions. We can't allow there to be a choice between saving lives and saving livelihoods. So will the government now act to close the gaps in support that have left 2 in 5 people who rely on self-employed income excluded from the current support schemes?
Dave? Well, Mr. Speaker, her question is one for my right honourable friend, the Chancellor of the Exchequer. He has done more than almost any finance minister around the world to support people, whether they're in employment or self-employed people, with some of the most generous schemes that have ever been put together. We appreciate that it isn't possible to save every job, but we have done the most that we possibly can. And I'll make sure that somebody from the Treasury gets back to her with a clear answer.
Steve Bryan. The Secretary of State knows that the vaccine rollout programme in Hampshire is in a very, very strong position. What he won't know is that by the close of play today, just over 40,000 people in the county will have had their first dose, which I think is impressive work by Dr. Nigel Waterson, who is leading that. Nigel Watson, sorry, there was a former colleague. The only thing holding us back, they tell me, is supplies. So does today's decision mean that their endeavour can match their ambition? And how many doses exactly will be in the country by the turn of the year?
Seriously?
Yes, I want to thank Nigel Watson and all of his colleagues who've delivered this fantastic effort across Hampshire. It is true that the current rate limiting factor on the rollout of the vaccine is the supply of the approved vaccine. We have to not only have it manufactured and in the country, but it needs to be, each batch needs to be checked, because of course it has to be in pristine condition, because the worst thing you can do is inject somebody with what you think is a vaccine that isn't working and hasn't been stored properly. So that does take time. We have 530,000 doses of the AstraZeneca jab ready to go. And they will be deployed from Monday. And in addition, we have over 3 million of the Pfizer vaccine that have been ready because we needed to hold 1 dose back. But once we move on to the once we move on to the 12-week window for dosage, for the Pfizer vaccine 2, which has been recommended today by the regulators and the JCVI as well, then we will be able to roll those out. But that will happen through January rather than immediately. The end result of all that, Mr. Speaker, is that we can significantly accelerate the rollout of the vaccine programme.
Let's head to Lewisham with Vicky Foxcroft. Vicky Foxcroft.
Thank you, Mr. Speaker. I've asked the Secretary of State for Health on several occasions for a timetable for the rollout of the vaccination programme. Now, thankfully, we have the AstraZeneca vaccine approved. Can he provide some certainty and a timetable which also prioritises unpaid carers, given that many care for extremely vulnerable people? You know, you've been asked this several times today. People really do need that hope to carry on in these difficult times.
Yes, Mr. Speaker, I totally understand why people want the answer to this question, because the hope that the vaccine gives us. But what I can tell her is that the speed of the rollout will be determined by the speed of the manufacture. And whilst we have the 530,000 doses that are ready to go from Monday, we also need to make sure we receive more approved doses. And we're working very closely with AstraZeneca on this, as we have with Pfizer. And that is that is what will determine the speed of the rollout. The NHS has a plan and is ready to go.
Let's go up to Harrow with Bob Blackman. Bob Blackman.
Thank you, Mr. Speaker. I have nothing but praise for the NHS workers who've been rolling out the vaccination programme thus far. But many of my elderly and vulnerable constituents have had to queue for more than an hour after their appointed hour for their vaccination to take place. So could my right honourable friend confirm the position that those many people who've already had the first dose of the vaccine, what do they do now about the second dose of the vaccine? Do they come for their appointed hour, or do they wait for a new appointment in several weeks' time?
Yes, those who have appointments before the 4th of January should come forward for their appointment. those who have appointments from the 4th of January onwards, those appointments will be rescheduled. I understand that this will obviously mean some effort from especially from in primary care, and I understand that some people are looking forward to having their second dose. However, the overriding health priority and all the clinical advice is that because we can get that the protection from the vaccine after the first dose to save lives, we need to move to the 12-week window rather than the 3-week window that we had with the Pfizer jab. On the point about people queuing and the need to make sure that that system is as efficient as possible, I haven't heard that happening elsewhere in the country, and if he may, I'll arrange for a meeting between my old friend and the Vaccines Rollout Minister to make sure that we can get to the bottom of that and make sure things are running as smoothly as possible in Harrow.
17 withdrawn. Sir David Ennis.
On this glorious and momentous Brexit Day, I celebrate with others that another vaccine has been approved. But will my right honourable friend join with me in thanking all NHS providers in Southend for their heroic efforts throughout the pandemic? And as a result of the increased number of infections, will he and his splendid team see what further help they can give us, particularly with delivering the new vaccine?
So State.
Yes, of course. The Brexit deal that the House has just passed with such an enormous majority will help support the UK life sciences, but also, this vaccine shows what we can achieve as a country. Working with international partners, absolutely, but what we can achieve with British science, British industry, British government, all working together, and the NHS working to make this happen. I'll absolutely work with him to support the NHS in Southend. It is under significant pressure. The case rate is very, very high in Southend. And I just ask everybody in Southend, the single thing that they can do is just try to limit all social contact unless it's absolutely necessary. It's not a nice thing to have to say. It's not easy to do, but it's absolutely necessary in Southend.
Let's head to Scotland with Martin Day. Martin Day.
Thank you, Mr. Speaker. COVID is a truly horrible disease which poses potentially long-term consequences for even the young and the healthy. So today's vaccine approval is truly welcome news and makes eliminating community transmission of the virus more possible than ever before. As such, is it the UK government's plan to loosen restrictions only when the most vulnerable have been vaccinated or when a significant proportion of the population as a whole have? And if so, what will that proportion be?
Well, we haven't set out that yet, because whilst the general approach we've set out is to vaccinate as many vulnerable people who are vulnerable to this disease as possible, as soon as possible, and then be able to lift restrictions. As I mentioned in my answer to my right honourable friend from the Forest of Dean, the question of the exact timing of that depends, of course, on the rollout of the vaccine, and it also depends on the impact of the vaccine on bringing down the rate of transmission. But because of the change in the dosing schedule from 4 weeks to 12 weeks, that means that we have that we can get through and get the protection to as many people as possible sooner and in a more accelerated way than we previously would have been able to do.
Craig McKinley.
Thank you, Mr. Speaker. The approval by MHRA of the Oxford AstraZeneca vaccine is great news at the end of a truly wretched year. Would my right honourable friend agree with me that the speed of rollout should be governed only by the rate of vaccine production? Can my right honourable friend assure me that his department will cut through all and any pettifogging rules and bureaucracy to make sure those newly retired or career break nurses and doctors can be approved as vaccinators, and that the only limiting factor will be vaccination production, not the availability of vaccinators or locations?
Yes, that is our goal. We've changed the law to make more people be able to inject vaccine. We've got a big training program on now. And at the moment, it is the supply that is the rate limiting step. We want to increase the rate of supply and increase the NHS capacity to deliver at the same time.
Let's head to Ealing Central with Dr. Rupert Huck. Dr. Rupert Huck.
Thank you, Mr. Speaker. By not needing extreme refrigeration,
The new Oxford AstraZeneca vaccine is a real breakthrough. So could the Health Secretary tell us how it's going to be administered to over 80s in care homes or at home who are too immobile to travel, maybe with carers, including dementia patients, under the hub and spoke model? Because locally, ambulances are needed, ICU is full, Ealing Hospital is on a black alert. And the way that doctors are being told to use oxygen sparingly is raising suspicions that it's running out. So look, hub and spoke, good on paper, but maybe time that the Secretary of State revisits it because it keeps throwing up loads of anomalies.
State.
The ability of the Oxford vaccine to be easily transported it does make a huge difference, because it means that we can take it to care homes and we can take the vaccine to the people rather than the other way around for those who are immobile. Of course, for people who find it easy to travel, it's much more efficient to do it the other way around. So we'll have a combination of a community rollout where we take the vaccine to the people, and also of vaccination hubs where people come to get vaccinated. It's about the combination, all based, as per my previous answer, on optimising speed of delivery of this vaccine. That's what both saves lives and gets us out of the restrictions as fast as possible.
Let's head to Keighley with Robbie Moore. Robbie Moore.
Thank you, Mr. Speaker. We all want to ensure our classrooms remain open so that our children's education continues with as little disruption as possible. We have seen the impact the armed forces personnel have had in Liverpool and Dover in helping carry out mass testing. So can my right honourable friend confirm if plans will be put in place to utilise our armed forces to assist with regular testing in schools, colleges and universities?
Yes, the Education Secretary is about to make a statement to set out more details, but the armed forces have been absolutely brilliant in all sorts of parts of the response to this pandemic, but one of them includes the support for schools to get mass testing underway, in an appropriate way, of course, but delivering and support using the experience that they've gained and helped us with so much over this crisis.
Let's head to Kingston-upon-Hull with Dame Diana Johnson. Dame Diana.
Thank you, Mr. Speaker. We've already heard that by mid-October, over 600 health and social care staff had already died from COVID. Professor Andrew Goddard, the president of the Royal College of Physicians, said today that frontline NHS and care staff must be vaccinated in the next couple of weeks as a priority, as the current pressures on the NHS will be impossible to withstand without a fit and protected workforce. So with today's further good news on vaccines, will the Secretary of State give our NHS workforce that undertaking that they will be vaccinated in the next couple of weeks?
Secretary of State.
We will vaccinate the staff of the NHS and social care staff as soon as we can. They are, of course, in the priority list. They're in priority group 2, except for social care home staff, who are in priority group 1. These are all set out according to clinical need, and that's the basis on which we'll vaccinate, but we'll also vaccinate at pace, and that often means that when there's some spare vaccines left at the end of the day, in a hospital, in a primary care setting, then vaccinating staff who are to hand and where that can be done, that is being done right now. So the answer, in short, is that we're trying to do this as quickly as we possibly can.
Let's head to Epsom with Chris Grayling. Chris Grayling.
Thank you, Mr. Speaker. Could I congratulate my right honourable friend and his team on the work they've done to put us in such a relatively strong position to vaccinate in the coming months, and also pay tribute to the team here at the Epsom St Helier Trust for the work they're doing at the moment. But, Mr. Speaker, this area has now been in Tier 4 for 10 days. There is a continuing acceleration in the number of infections reported locally. So by definition, those are not happening now in the business premises that were closed as a result of moving to Tier 3 and Tier 4. So what can the Secretary of State tell us about what information he has about where these infections are now being transmitted under Tier 4?
Thank you, Mr. Speaker. The majority of infections happen within the household, from one person in a household to another. And that is perhaps inevitable because we're physically closest to those with whom we live. Over the last 10 days, it has not yet been possible to do a full analysis of where we think the transmission is happening within Tier 4. And the reason for that is simply that the data aren't available, and the data are particularly difficult to interpret over the Christmas period. But I'm very happy to keep talking to my right honourable friend about to try to understand as much as we can about where these transmissions are happening, because that is the route to keeping them under control in as least damaging a way as possible until we can get the vaccine rollout completed.
Sent to Birmingham with Steve McCabe. Steve McCabe.
Thank you, Mr. Speaker. I also welcome the vaccine news. I know the Secretary of State's a keen advocate of the use of lateral flow tests in care homes. In one group consisting of 3 homes in my constituency, it's taking 1,000 staff hours per month to deliver just under 4,000 tests. This isn't manageable without neglecting other vital duties. What can the Secretary of State offer by way of help?
Thank you, Mr. Speaker. We have put in more support to help care homes with the challenges that COVID throws up, both testing and other things like PPE that are so necessary. I'm very happy to arrange a meeting between him and the Care Minister to see what more can be done, and in particular whether the burden that he describes of time taken to do these vital tests can be minimised in some way.
Let's head to Chislehurst with Sir Robert Neal. Sir Robert.
Thank you very much, Mr. Speaker. Can I welcome the work that the Secretary of State is doing, and in particular his answer to my honourable friend about the importance of getting enough vaccinators, because even within London boroughs, I'm conscious of a difference in the speed of rollout to even very vulnerable people. In my constituency, I have a number of recently retired medical people, doctors, clinicians, nurses, who would willingly volunteer if they're asked, but also will he make approaches, or has he made approaches, to the private healthcare providers, many of whom, as I understand, would have capacity and, I'm told, will be willing in some cases to make their staff available on a pro bono basis to help the NHS to roll out this vaccine.
Yes, I'm pretty sure that has been done. And if it hasn't, then I will absolutely check and get back to my honourable friend. And just to say also that for anybody who is clinically qualified, then if they come forward, we are very enthusiastic to hear from them. NHS professionals, the body that is responsible for extra staff in the NHS, is organising the distribution of those who want to come back into service in order to help to vaccinate, and we look forward to hearing from people.
Let's head to South Shields with Emma Llewellyn-Burke. Emma Llewellyn-Burke.
Thank you very much, Mr. Speaker. My constituents will be gutted today. We are making sacrifices and our beautiful town's economies tanking. More so, the tiering system isn't working. Areas that previously moved into Tier 4 still have rising infection rates. So what evidence is the Secretary of State using that shows moving South Shields from Tier 3 into Tier 4 will actually reduce the spread of the virus?
Mr. Speaker, it is not easy moving from Tier 3 to Tier 4. I understand that. But the rates in South Shields are going up sharply. And with the support of the council, and indeed all of the councils across the North East, we've taken this action. The evidence base is that that in Tier 4, for the areas that have been in Tier 4 the longest, we are starting to see a reduction in the rate of increase, and in some places a fall, particularly in some parts of Kent. But there's still an awful lot more to do. And this new variant, which now we can see, sadly, in the northeast of England, in the way that it started very much in the southeast, this new variant spreads so much more easily. It is much harder to keep control of. So the job of suppressing the virus has got harder with the new variant, at the same time as the approval of the vaccines has made the job of getting out of this with the vaccine easier. And that is the challenge that we face.
Thank you, Mr. Speaker. Yesterday I went to visit the vaccination hub at Peterborough City Hospital. After everything we've been through, and after seeing hope behind the smiles of those waiting for the jab, I must confess to feeling almost emotional during my visit. And I want to place on record my thanks to everyone working at the hub and within the wider Peterborough NHS. With the superb news today of the approval of the Oxford AstraZeneca vaccine, it is now the time to prioritise the vaccination of NHS staff to prevent staff shortages and ease NHS winter pressures.
Yes, Mr. Speaker, my honourable friends speak so powerfully for Peterborough. I'm glad that the vaccination centre is working well in Peterborough, and this new vaccine does mean that we can accelerate the rollout of the vaccine to NHS staff, and that is good news in Peterborough and across the country.
I said to Wallace it with Angela Riedel. Angela Riedel.
Thank you very much, Mr. Speaker. The Secretary of State has today announced 23 more areas to move into Tier 4, and 3/4 of the country now is in Tier 4. How long before he looks at this again and can make other announcements? And what further escalation will he be considering if even Tier 4 doesn't bring down these soaring infection rates?
Well, for areas in Tier 4 where we still need to get the infection rate down, the most important thing that we can all do is take responsibility to restrict the spread of infection, because this new variant spreads so easily from person to person, and everybody has to behave. If everybody behaves like they might have the virus and therefore restricts their social contact, that is the best way that we can get these rates down. So it does take all of us to do this. It isn't just about the rules that are set out from this dispatch box and voted on by this House. So I know that people in Wallasey and across Liverpool have done so much and got the rates right down under control, but unfortunately they have started to rise again. And with the new variant, it has been necessary to put Liverpool into Tier 3. But I just hope that, like the rest of the country, we can get out of this after the next few difficult weeks.
I said to Amersham with Dame Cheryl Gillan. Dame Cheryl.
Mr. Speaker, Buckinghamshire health services are under severe pressure with escalating rates of COVID and hospital admissions. And certainly on behalf of all my colleagues in Buckinghamshire, can I say an enormous public thank you to our healthcare staff who are working round the clock in a growing emergency, as well as providing testing and vaccinations at multiple sites in the county. Despite these pressures, the Trust is establishing a centre to help people with the effects of long COVID, which are now causing increased concern, and this will be at Stoke Mandeville. What extra resources can the Secretary of State make available to support our valiant health workers, and in particular to help those that are now suffering from the effects of long COVID, which are very serious in some cases?
Mr. Speaker, my right honourable friend is absolutely spot on. The issue of long COVID is very serious, and we've put in more support into the NHS and into research to try to understand long COVID better. I know about it very much myself, and I understand the impacts that it can have that can be debilitating on people's lives. I'm delighted that there's a long COVID centre at Stoke Mandeville. It's such an excellent hospital. I'm not surprised that it's doing all of the cutting edge work that's needed. But the single most important thing we can do to support those who have long COVID is understand better the causes, and therefore understand what we can do to help people get their lives back to normal.
Let's head up to Enfield North with Farrell Clark. Farrell Clark.
Thank you, Mr. Speaker. Mr. Speaker, the Secretary of State has in many statements over the past 10 months said that we have the virus under control, and only 2 weeks ago said that we can't risk letting cases rise again. Yet that is exactly what is happening under his watch. Yesterday, the UK reported another 53,135 cases of coronavirus, the highest record daily total since the pandemic began. With many hospitals in London and South East at breaking point, it is clear that the government has lost control of the virus. So with schools set to go back in a week's time, what public health strategy does the Secretary of State have in place to keep our children, their families and teachers safe?
Well, thank you very much, Mr. Speaker. The new variant of this virus does make it very difficult to control, and that's why it's so important that everybody follows those public health messages. And that's the challenge that we are all dealing with together, and we've just got to remember that we're all on the same side in that great battle. But there is more. There is help on its way in the testing for schools, in the measures that my right honourable friend, the Education Secretary, is shortly to announce, and also of course, in the vaccine, which will help to protect those who are most vulnerable. And then once we've got through all the clinical prioritisation, we can then move on to those, generally the under 50s, for whom the risk of death from COVID, thankfully, is low, but still will highly likely want to have a vaccine to protect themselves from this disease.
Thank you, Mr. Speaker. I first want to commend the Secretary of State for making it clear that the vaccine will be available to all over 65s, hopefully by the end of February. I think that's really important. But, Mr. Speaker, this should be a joyous day. We've been given the gift of a free trade agreement with the EU from our Prime Minister. We've been given the gift of a new vaccine, and we have a new vaccines minister by our scientists and world-leading government objectives. But the gifts that people really want this Christmas is to know that their jobs, livelihoods and civil liberties will be given back to them as soon as possible. So will the Secretary of State make it clear today by telling us at what point on the priority list for vaccinations will he allow restrictions to be lifted?
Thank you very much, Mr. Speaker. Well, we've got to remember that the vaccine is a great symbol of hope, but it is a means to an end, and the end is the lifting of restrictions and the restoration of our liberties and the freedom for us to act as we please. And that is the goal of this programme, to make people safe so that we can get life back to normal. And of course, protect the NHS. In terms of the timing, it is absolutely right. As I said in my response to my right honourable friend from the Forest of Dean, it is absolutely right that the speed of rollout can be accelerated because of the decisions announced this morning. The precise timing of that has to be determined by the manufacturer. Because whilst we can forecast that, we can't know exactly how much will be delivered. And on the question of how far down the list you need to go, the priority list you need to go, before people are safe, we will observe that as we observe the reduction, I hope, in transmission that you get, as well as the protection of individuals. So we'll keep this under review. But the good news is, it is now, I am highly confident that by the spring we will be through this. And it was not possible before the approval of this vaccine to be able to say that.
With Clive Efford.
Can the Secretary of State say what information he's received from experts in SAGE about the role that schools played in the spread of infection in places like South East London? And does this suggest that we should have a rollout of a mass vaccination programme for schools?
We will vaccinate according to clinical need, because that's the best way both to protect lives and to be able to lift the restrictions.
34 withdrawn, so we're going to Daisy Cooper in St Albans. Daisy Cooper.
Thank you, Mr. Speaker. Even once vaccinated, some older and clinically vulnerable people will have no one to look after them if their unpaid carers get ill with coronavirus. Vaccinating unpaid carers would be a very clear way of reducing pressure on the NHS and social care, with the double benefit of protecting them and providing the care that the NHS and social care system would not need to provide. So will the Secretary of State give an unequivocal commitment that unpaid carers will be included in priority categories for vaccination?
Mr. Speaker, as I just said, we will absolutely vaccinate according to clinical need. And once we're through those clinical need cohorts, then of course there is a very important call on the next set of prioritisations, which we haven't yet set out. Both teachers and unpaid carers have a good case to make.
Let's head up to Newcastle under line with Aaron Bell. Aaron Bell.
Thank you, Mr. Speaker. As the Health Secretary said, today is clearly a day of mixed emotions. I hugely welcome the news about the Oxford vaccine, and I'd like to pay tribute to Cobra Biologics in my constituency of Newcastle under Lyme, who've been manufacturing that and have been involved since the outset. But moving Staffordshire to Tier 4 is very tough on the people of Newcastle, who've worked so hard to get our rate down, and it is currently stable and indeed slightly falling. I do understand the risk of the new variant, but will the Health Secretary confirm that there is a way out of Tier 4 and that he will take into account vaccination rates and the effect on the NHS and not look purely at case numbers once we've got the vaccination programme rolled out?
Yes, I absolutely will. We already do look at, of course, the impact on the NHS, but that will become more important as more and more people are vaccinated, and the correlation between cases and future hospitalisations, which currently is stable, that correlation, we hope, will start to go down, and there will be fewer hospitalisations for every individual case, and obviously we should take that into account.
Let's head up to Islington North with Jeremy Corbyn. Jeremy Corbyn.
Thank you, Mr. Speaker. As everyone knows, the vaccine is important and necessary, but we also know that the effects of corona have fallen disproportionately on the most vulnerable within our society. The World Health Organization asked for special consideration to be given with those with disabilities, yet a wholly disproportionate number of the deaths that have occurred have been with people with disabilities. And also those with learning disabilities have often lost out on the support they would normally receive. And we have 1.5 million children who are faced with mental health problems, if not crises, at the present time. Can the Secretary of State assure us that work will be done to give support, particularly to those with disabilities, and in particular, work will be done and greater support given for young people and children who are suffering often quite profound mental health difficulties as a result of the stress of isolation that they've had for the past 9 months?
Yes, of course, this has been looked into in great detail, and the clinical prioritisation includes those who are under 50 but are clinically vulnerable to the effects of COVID-19, and they will be they come into the prioritisation in categories 4 and 6 alongside the over 70s and the over 60s, taking into account precisely the sort of consideration that the Right Honourable Gentleman sets out.
The main effort is the protection of the NHS. Surely the moment we start getting a reduction in hospital admissions, we can start lifting the restrictions.
Well, yes. In principle, the point is that to protect the NHS and to stop people from dying from the disease, and whilst at the moment cases are a very clear proxy for future hospitalisations and future deaths, as the vaccine is rolled out, we would hope that for every number of cases, you would have fewer hospitalisations and fewer deaths. And it's the protection from hospitalisation and deaths that the vaccine gives us, which is why it is the route out of the crisis.
Thank you.
Thank you, Mr. Speaker. Mr. Speaker, I pay tribute to the Homerton Hospital in the heart of my constituency, which is working flat out now, all the staff there, with a rising number of cases, and to the Royal London in the neighbouring constituency, which of course had a queue of ambulances with COVID patients waiting to be treated. Given this pressure on the NHS, which I know the Secretary of State feels very strongly about, obviously, as well, what's he doing to make sure that the nurses and other staff we need are available? Recent press reports suggest that of the 71,000 available nurses, only just over 1,000 had been deployed. Is he working with the Nursing and Midwifery Council to track down those with the right registration, the right skills, and get them into the right places?
Yes, it's incredibly important that we support the NHS with the workforce that it needs, both permanent workforce, and we've increased the number of nurses by over 13,000 in the last 12 months, but also temporary workforce over the next difficult few weeks that we've got ahead of us in the NHS. So yes, I'm working with the NHS and others on exactly that question that she rightly raises, and can I also join her in praising the team at the Homerton who are doing a great job.
Let's head up to Stourbridge with the final question from Suzanne Webb. Suzanne Webb.
Thank you, Mr. Speaker. There is no doubt the news of the vaccine and the Brexit deal is a grand finale to what has been a difficult year, albeit with mixed emotions as constituencies like mine go into Tier 4. As a fitting way to end this statement today, will my right honourable friend join me in thanking everybody working in the NHS and in social care, not just across my constituency, but all constituencies, for the work they have done this year, and especially those who worked tirelessly over Christmas to help keep the most vulnerable safe. But will my right honourable friend also extend an extra special thank you to all those caring for children with disabilities and special needs, such as Lifted Spirits, who are a bunch of mums and dads in my constituency as I'm sure my right honourable friend will agree that this has been a particularly challenging year too for those as carers.
Mr. Speaker, in what I hope is my last statement of the year, and is most likely my last answer of the year, can I thank my honourable friend for her question, and in particular, not just for praising those at Lifted Spirits and others who are doing so much to care for others, but to give me the opportunity and the prompting to thank NHS staff who during 2020 have done more than almost certainly any other year since its formation, and also the social care staff of this country who have gone out of their way to care for others and to care for those who are most vulnerable, not just to COVID, but to other health problems too. There is no limit to my gratitude to those who are working so hard, and they really put their shoulders to the wheel. And the attitude of the NHS, which is when there's a crisis, we lean in and we come together and we fix it. That attitude inspires me, and I know inspires so many other people.
In order to allow the safe exit of honourable members participating in this item of business and the safe arrival of those participating next, I'm suspending the House for 3 minutes. Order. Order. I call the Secretary of State for Education to make a statement. Secretary of State Gavin Williamson.
Thank you, Mr. Speaker. And with permission, I'd like to make a statement regarding our plans for bringing children back to school this academic term. Dealing with this pandemic has always been an exercise in managing risk. Throughout, we have been adamant that the education of children is an absolute priority, and that keeping schools open is uppermost in all of our plans. The magnificent efforts of all the leaders, teachers and staff in all of our schools and colleges have ensured that settings are as safe and COVID secure as possible. But we must always act swiftly when circumstances change. The evidence about the new COVID variant and rising infection rates have required some immediate adjustment to our plans for the new term. This is, of course, a rapidly shifting situation, but some things remain constant. We continue to act to preserve lives and safeguard the National Health Service. And we continue to protect education by putting children first. Above all, our response is proportionate to the risk at hand and makes every use of a contingency framework that we put in place earlier this year. The latest study we have from Public Health England is that COVID infections among children are triggered by changes in the community rate. The study also says that the wider impact of school closures on children's development would be significant. I'm quite clear that we must continue to do all we can to keep children in school. Taking all these factors into account means that we have had to make a number of changes for the new term in order to help with breaking chains of transmission and to assist with keeping all of our children and our education settings as safe as we can. The fact that we have managed to do this so successfully throughout the entire pandemic is due to the incredible dedication of all our teachers, leaders and support staff, and I know that the House will join me once more in thanking them for everything that they continue to do to keep children learning as safely as possible. Accordingly, we'll be opening the majority of primary schools as planned on Monday, the 4th of January. We know how vitally important it is for younger children to be in school for their education, well-being and wider development. In a small number of areas where the infection rates are highest, we will implement our existing contingency framework such that only vulnerable children and children of critical workers will attend face-to-face. We will publish this list of areas today on the gov.uk website. I'd like to emphasise that this is being used only as a last resort. This is not all Tier 4 areas, and that the overwhelming majority of primary schools will open as planned on Monday. The areas will also be reviewed regularly so schools can reopen at the very earliest moment. Ongoing testing for primary school staff will follow later in January, and we will be working to establish an ambitious testing programme helping to break chains of transmission and reducing the need for self-isolation where students and staff test negative for the virus. We have already announced our intention for a staggered return to education for this term for secondary age pupils and those in colleges. Because the COVID infection rate is particularly high among this age group, we are going to allow more time so that every school and college is able to fully roll out testing for all of its pupils and staff. I would like to thank school leaders and staff for all of their ongoing work in preparing this. This kind of mass testing will help protect not just children and young people. It will benefit everyone in the community. It will break those chains of transmission that are making infection rates shoot up. This, in turn, will make it safer for more children to physically return to school. All pupils in exam years are to return during the week beginning the 11th of January, with all secondary school and college students returning full-time on the 18th of January. During the first week of term, on or after the 4th of January, secondary schools and colleges will prepare to test as many staff and students as possible and will only be open to vulnerable children and the children of key workers. The 1,500 military personnel committed to supporting schools and colleges will remain on task, providing virtual training and advice on establishing the testing process, with teams on standby to provide in-person support if required by schools. Testing will then begin the following week in earnest, with those who are in exam years at the head of the queue. This is in preparation for the full return of all pupils in all year groups on the 18th of January in most areas. To allow this focus on establishing testing throughout the first week of term, exam year groups will continue to have lessons remotely in line with what they would receive in class, and only vulnerable children and children of critical workers will have face-to-face teaching. As with primary schools, we'll be applying our existing contingency framework for education in areas of the country with very high rates of COVID infection or transmission of the virus. This will require secondary schools and colleges to offer face-to-face education to only exam years, vulnerable children and children of critical workers, with remote education being given to all of the students if they are in one of those contingency framework areas. We're also asking universities to reduce the number of students who return to campus at the start of January, prioritising students who require practical learning to gain their professional qualifications. All university students should be offered 2 rapid tests on return in order to reduce the chance of spread of COVID. To support remote education and online learning during this period, the government expects to deliver more than 50,000 devices to schools across the country on the 4th of January alone, and over 100,000 altogether during the first week of term. This is in addition to the 560,000 devices that have already been delivered, as we continue aiming for a target of over 1 million devices to be distributed for the children who need them most. This programme is now being extended to include students aged 16 to 19 in colleges and schools. So often, Mr. Speaker, we have had to close things down to try and beat this awful disease. But with schools, our best line of attack is to keep them open using mass testing tools that we now have available, so that we can ensure that children are able to continue to gain the benefit of a world-class education. As we continue to hear more encouraging news about the vaccine rollout, I am more determined than ever that children will not have to pay the price for beating COVID. Mr. Speaker, I've spoken many times of my determination that we cannot let COVID damage the life chances of an entire year of children and students. With these plans, which allow for rapid testing and a controlled return of schools, I'm confident that we can minimise the latest health risks posed by the virus, and I commend this statement to the House.
We now go up to Stratford and Lumsden to the Shadow Secretary of State, Kate Green. Kate Green.
Mr. Speaker, before I begin, I'd like to place on record my thanks and the thanks of the whole Labour Party to every leader, every teacher and lecturer, the support staff, early years professionals and social workers who've moved mountains to keep children and young people safe and educated in the face of enormous odds. They deserve not just the thanks of this House, but genuine support. And I hope when he stands up again, the Secretary of State will give more information about that support. May I also thank the Secretary of State for advance sight of his statement, but the truth is we should not be in this position. Only days before many schools should have been opening again to all pupils, the Secretary of State has announced that many will not be returning as planned. This delay and disruption to children's education is a direct result of government's failure. They've lost control of the virus. Now they're losing control of children's education. The cost to pupils, the pressure on staff, and the challenges for families caused by school closures are huge. But we know that action must be taken to control the virus. So is the Secretary of State confident that the measures he's announced today will control the virus, and will he publish SAGE's advice on this issue? There is consensus across the House that the best place for children is in school, but the government's failed to give schools the support they need to make that happen. For months, Labour's been calling for mass testing in schools. The Secretary of State announced it just before schools broke up for Christmas, creating huge additional work for overstretched school staff. But just 2 weeks later, it's clear his plan has failed, and many schools will not open as planned next week. Can he tell us how many schools do now have testing infrastructure in place, And how many will have it next week and the week after? Can he guarantee that every school will have the testing it needs when due to open again? Mr. Speaker, the Secretary of State's announcement that some primary and secondary schools will not reopen to pupils in January will be a cause of huge concern to parents. Can he tell us how many primary and secondary schools will not be opening, how many pupils will be affected, and will students not in exam classes receive remote teaching while their school is closed? I'm hugely concerned that even with school open to them, the most vulnerable children may simply not attend. Can the Secretary of State tell us how he plans to keep them safely in school in the weeks ahead? I'm glad the Secretary of State announced an expansion to remote learning, but I remain concerned that it's not sufficient to support all pupils. Can he guarantee that every pupil will have the device and the connectivity that they need to learn? And will he ensure that this is available for every child whose school isn't open? Will there be any support for parents with children who can't attend school? Can he confirm that parents can be furloughed if they have childcare commitments? Can this also happen on a flexible basis that allows parents, and particularly mothers, to balance work with caring for their children? Many people who are clinically extremely vulnerable will be concerned about a return to school, whether they are vulnerable parents of a child or a vulnerable member of staff. What reassurance and support can he give to them? Mr. Speaker, it's been reported in recent days that teachers will be prioritised for vaccination, but an announcement today suggested there wouldn't be prioritisation based on occupation, and I understand the clinical priorities for the first phase of the vaccination programme. But does the Secretary of State believe that not only teachers, but all school staff, including in special schools, should be prioritised for vaccination thereafter in order to protect them and safeguard children's education? Turning to exams, Mr. Speaker, the government's failure to get a grip on the virus has caused huge disruption to pupils' education, disruption that will continue into the new year. Will the Secretary of State be making any changes to his plans to reflect this? Labour said time and again that there needs to be a credible plan B in the event of disruption continuing that means exams can't take place fairly. This is now urgent. Over 100,000 young people will be taking exams in the next few weeks in BTECs and other vocational qualifications. Can the Secretary of State tell us what he's doing to make these exams fair? The Secretary of State told us weeks ago about the expert group on learning loss, but at the time couldn't tell us who was on it, when it would sit and when it would report. Can he answer those questions today? And I welcome the decision to delay the return of students to university in January, sadly necessary for public health. Can the Secretary of State confirm he's discussed this with unions and university and student representatives? In conclusion, Mr. Speaker, we should never have been in the position we're in today. If the government had acted quicker, followed the science, and given schools the support that they needed throughout this pandemic, we wouldn't be facing a new year with this new wave of infections and huge disruption to the lives of pupils, their families, and staff across our education system. The government have lost control of the virus, and it's children and young people across the country who are paying the price.
Secretary of State.
Well, thank you ever so much, Mr. Speaker. And I do thank the Honourable Lady for echoing my words and my thanks to all teachers, leaders and all those who work in our schools, colleges and childcare settings for the wonderful work that they do. And she talks about what extra support, Madam Deputy Speaker, that we are giving those schools in terms of rolling out the largest mass testing exercise that this country has seen in terms of ensuring that children are able to get back into school and able to have the benefits of being in school. And we're supporting them not just in terms of making sure that they have the equipment that is due to be delivered to all secondary school settings on the 4th of January. We're also supporting them with extra finance, a package of £78 million in order to help them get this mass testing programme set up, established and there to test all students and all staff as they return back into secondary school. This is about taking the opportunity to be able to have a real opportunity to beat back this virus, have a real understanding of where the infection is within the community and making sure that schools are even safer than they have already been. She asks about the SAGE advice, and of course, as the Honourable Lady knows full well, that it is SAGE that publishes its advice, and it will of course publish its advice soon. The contingency framework, again, this is something that was published and has been a public document for a number of months now, so I'm sure the Honourable Lady has had the opportunity to look at it, and it makes quite clear that actually those schools that are placed in part of a contingency framework, there needs to be the continued delivery of remote education in those schools. And just to be clear, those children who are in exam group years will be returning back into secondary school, even if they're in a contingency framework area on the 11th of January. She rightly highlights the issue of vulnerable children. I think that our school system can be rightly proud, as well as our local authorities and social workers, for the amazing work that they have been doing with those children who are most vulnerable in society, to ensure that we do everything to get them attending school, making sure that they have the protection of school around them. And those efforts, working with local authorities, working with the police and working with schools, will continue. And finally, she raises the issue that there are many students who are about to take examinations in technical and vocational qualifications in the early part of January. Those assessments will continue as planned in those educational establishments that are delivering them.
Now we go to Harlow, to the Chairman of the Select Committee, Robert Halfon.
Thank you, Madam Deputy Speaker. I believe that my right honourable friend wants to keep schools open and teachers and children safe. However, I have real worries about the effect of school closures, particularly hurting vulnerable children and putting enormous pressures on parents. Can I ask him to set out what risk assessment the government has made on the impact of school closures for millions of pupils on educational inequality, well-being and mental health, especially when the Royal College of Paediatricians has stated that eating disorders amongst young people has gone up by fourfold, partly because of school closures and social isolation? Will the department introduce a tracker on individual pupils, at least those in exam years, working with schools and local authorities to ensure that those at home get the learning they need? And will he ensure that teachers and support staff get priority for vaccinations so we can get our schools open again soon? And finally, will he thank teachers and support staff in my constituency of Harlow who are doing all they can to keep children learning?
Well, I would very much like to join my right honourable friend in thanking the teachers and support staff who've done so much in his constituency of Harlow to keep children learning. And the importance of school is the reason why that we're continuing to proceed with opening primary schools on the 4th of January. The importance of education means that this is why we're rolling out the mass testing regime to ensure that secondary school students across the majority of the country are going to be able to be returning back into school. We know how important it is. Children need to be in school, and that is why we'll always do everything we can do to resist knee-jerk reactions to close schools or colleges, because we recognise how important it is for children's life chances for them to be in schools. My right honourable friend raises the important issue of impact of lost learning, Madam Deputy Speaker. That is why we commissioned EPI and Renaissance to do a close study on lost learning, and we'll be looking particularly closely at the impact, especially among exam year cohorts, as well as the wider school population, to make sure that that is there to inform us on any future policy decisions.
And we go to Glasgow, to Carol Monaghan.
Thank you, Madam Deputy Speaker, and I thank the Secretary of State for advance sight of his statement. And I'd like to join others in recognising the work that our teachers and school staff are carrying out in some very challenging circumstances. And I do hope they're managing to get some well-deserved rest over the Christmas break. This new COVID strain means it's difficult to make concrete decisions and commitments for the future. But the problem is that the Secretary of State is once again making last-minute decisions that leave schools with absolutely no time to plan. So firstly, can the Secretary of State outline how his actions align with the advice received from SAGE? Ongoing testing for school staff is welcome. However, anyone that's spent any time in either primary or secondary schools will know that these are busy, often tightly packed environments. And according to Professor Neil Ferguson, this new strain hints at a higher propensity to infect children. So we're asking teachers, some with underlying health conditions, to work in this potentially risky environment. NHS and frontline care staff must of course be prioritised for the vaccine, but following these groups, will he ensure that teachers are a priority for vaccine? None of us want a return. Apologies, Madam Deputy Speaker, I can't hear you here. Can I finish off by saying there is a massive difference between posting activities online and actual live online teaching and learning with real-time interactions between a teacher and their class. So what steps is he taking to ensure that schools have the capacity and bandwidth to deliver proper online learning? And will the Secretary of State accept that he may need to amend his current strategy if the need should arise?
Secretary of State.
Well, I thank the Honourable Lady, the Honourable Member for Glasgow North West for her comments, and recognising the fact that we are in a situation that is rapidly changing, and we do sometimes have to adapt our responses as a result of a changing coronavirus. And I know that there's been similar challenges faced within the Scottish Government as has been faced within the UK Government as well. We do recognise the fact that this new strain means that we have to take a different approach, and that is why we've moved from saying that the mass testing regime that we're rolling out within secondary schools has to move from being something that was optional and an offer to schools, but something that we're requiring schools to do. Because schools are a unique environment, it's important that we put as many protections in place. And like her, I want to see all teachers be very much right up there to be in the best possible position to be vaccinated, so they can carry on the incredibly important work of keeping children in education. And I'm incredibly pleased that we are in a position to ensure that primary schools are opening on the 4th of January. Secondary schools are going to be welcoming back children from in those exam cohorts on the 11th of January, as well as all other pupils on the 18th of January.
James Cartledge.
Thank you, Madam Deputy Speaker. It's obviously been fantastic news today that we've heard about the Oxford AstraZeneca vaccine. So can I join with the previous two questions, including from my honourable friend, the Chairman of the Select Committee, to urge my right honourable friend to do what he can within current policy to ensure that teachers are prioritised for the vaccine? Does he not agree that were we to vaccinate as many teachers as possible, as soon as possible, this would not only make schools safer and boost teacher morale, but actually would reduce part of the pressure on closing schools in the first place?
Well, I often agree with my honourable friend, and I don't disagree with him on this occasion. Now, obviously, the decision in terms of vaccination has to be prioritised across a whole raft of areas, but the key thing is those people who are most clinically vulnerable. But as we get through that stage of clinical need, I would certainly hope that we would be able to look at how we can use vaccinations for those who are in the teaching profession and who support education.
Now we go to St Albans. Daisy Cooper.
Thank you, Madam Deputy Speaker. We are in a race against time to stop a new catastrophe of educational inequality. Some children have lost more than 6 months of learning. Some schools still can't access the COVID workforce budget because of absurd criteria. It is shocking that only half of digital devices have been delivered and that mass testing is only being rolled out 4 months after schools returned. So when will the Secretary of State give schools the rota powers, the funding, the devices and the trust that they need and deserve to stay open safely?
Well, thank you, Madam Deputy Speaker. We had announced the additional £78 million worth of funding just before the Christmas period in order to help and assist them in the rollout of mass testing regime in all secondary schools. We actually only announced the distribution of an extra 500,000 devices on the 500,000 that had already been distributed just the other week. And if she had listened to my statement, she would have actually heard that we're planning to distribute 50,000 on the 4th of January and another 100,000 over the following week. But I'm sure she'll at some point maybe look at my statement in detail and pay attention to it.
Now we go to Dudley, to Mike Wood.
And my children are in the next room paying rather more attention than is usual to the House's proceedings this afternoon. But what steps is my right honourable friend taking to help schools and colleges to take up the offer that the government has made to provide rapid testing, which will be so vital in helping to keep children, teachers and indeed parents safe?
Secretary of State.
Well, I think my honourable friend makes an important point. This isn't just about helping schools. It's not just about helping pupils and that workforce within the schools, but it's helping the families with school-aged children. It's helping the whole community push back the tide of this virus, because we'll be testing more people as a result of this than ever before, literally testing millions of children every single week. And yes, we recognise that schools need that extra support. That's why that we created the fund of £78 million in order to be able to support them. And we've shared that information with schools the other week as to how much money that they'll be eligible to get. But we do understand that there'll be some schools that have unique problems or challenges in rolling out this mass testing, and that's why I'm incredibly grateful to Her Majesty's Armed Forces for making themselves available, as well as Ofsted, in supporting schools who are having challenges in rolling out the mass testing programme to ensure that it is implemented in all secondary schools and all colleges, because this will benefit everyone within school, everyone in college and everyone within the community.
Now we go to Warwick and Leamington, to Matt Western.
Thank you, Madam Deputy Speaker. Like so many frontline workers, teaching staff are deeply committed to their profession, but they've also been among the most vulnerable, particularly given that it's been amongst the 12 to 17-year-olds that have been a major vector for transmission. I spoke with head teachers just before Christmas, and they were left angered by the government's late announcement to introduce testing without any support and little direction. And today we hear there will be a delay to schools reopening. So can I ask the Secretary of State just 2 points? As I asked him back in November, will he prioritise frontline teaching staff for vaccinations, given the political will to keep schools and colleges open as much as possible? And secondly, given that so many students will be taking BTECs and other technical and vocational qualifications exams in the next few weeks, what support the government will be providing to those students and the staff assisting them?
Well, the Honourable Member for Warwick and Leamington is right to highlight the issue of those children taking BTEC qualifications, and we made the decision about the importance of those youngsters being able to continue to take those qualifications over the coming weeks. In terms of vaccination, and he's picked up on the thread raised by previous questioners, obviously as Education Secretary it isn't within my remit to determine as to who will be receiving the vaccinations, but I would certainly hope that when we are through that process of working through those groups who are most vulnerable to COVID, then those who are working in our education settings are looked at in the most positive way to ensure that they are high up on the list of receiving those vaccinations.
Now we go to Newcastle, to Aaron Bell.
Thank you, Madam Deputy Speaker. And can I join the Education Secretary in paying tribute to all those working in schools in these difficult times. I welcome his statement and the announcement that all secondary school and college students will receive 2 rapid tests at the start of the new term to identify asymptomatic cases. But I know this as a father myself, it's the self-isolation that's caused such disruption for teachers, students and pupils. So can he confirm that it's his intention to use rapid testing of staff and students who've come into contact with confirmed cases to help reduce the need for self-isolation? And will this be available daily if necessary?
I can absolutely confirm to my honourable friend that that will be available to both students and staff members in secondary school settings, and how important it is. This means that we'll be in a position to reduce the number of children and teachers who are having to self-isolate, and it means that it will be easier for education settings to fully work as normally as possible, but most importantly, students to be in a position to maximise the amount of time that they spend studying.
Now we go to Pontefract and Castleford, to Yvette Cooper.
Thank you, Madam Deputy Speaker. Pontefract New College is currently having to organise the mass testing for twice weekly for 2,500 sixth formers, but they've had no allocation of funding, no contact from the military. They're having to find additional staff, and they have no space in order to do these tests as well. Why has the government not given schools and colleges a clear allocation of funding that will cover additional staff, that will cover DBS checks, that will cover the practicalities of delivering this mass testing? They all want to do this mass testing, but frankly, the support that they are getting from the ministers and the education department is always too late, always too chaotic, and frankly, isn't giving them the support they need to keep children safely in education.
Well, I'll certainly make sure the information is passed on to the Right Honourable Member. It was published before Christmas and was available to colleges and schools, but I'll make sure that my private office forwards it on to her and where they can get that information, because it is readily available and should hopefully be of assistance in her duties as a constituency Member of Parliament.
Felicity Buchan.
Thank you, Madam Deputy Speaker. I'd like to pay tribute to all of the teachers in Kensington and Chelsea who have been heroic in their efforts to keep schools open, even with very high case rates in London. Can my right honourable friend clarify whether London will be part of the contingency framework? And also, he mentioned, I believe, a 2-week delay. Can he clarify whether schools will definitely reopen after 2 weeks, or whether there will be a review at that point?
Secretary of State.
My honourable friend is right to ask that question, and after the 2-week period there would be a review. Our obvious hope and desire is to see that those areas that are in the contingency framework to be moving out of that, but we'll obviously be guided by the public health advice and the scientific advice that is available to us. It's very important that these decisions aren't made on a regional basis, but on a local basis, because at every stage I want to see the maximum number of children in school, and that sweeping decisions aren't made, and we minimise the disruption to children, to schools and to parents as much as possible.
Now we go to North Durham, to Kevin Jones.
Thank you, Madam Deputy Speaker. It was disappointing that the Secretary of State didn't make a statement to the House before the Christmas recess, and that mixed messages across Christmas from his department has led to much anxiety amongst parents, teachers and students. I doubt whether his statement today is going to reassure many of them. Can I ask on testing what the role of local directors of public health are going to be? And also, who is going to support individual schools and colleges? Because 1,500 army personnel are not going to be enough to fill that task. And also, more importantly, what will happen to the data that is collected from this testing? Without a comprehensive, locally based plan, is in danger of making all the same mistakes that we've seen in terms of the national test and trace system. Can the government not wake up to the fact that local plans need to be put in place, not dictated from nationally? They will not work.
Well, the Right Honourable Gentleman raised an important point about how vital it is to work with local directors of public health, local authorities, and we believe that this will be an enormous assistance to those local authorities of identifying where more COVID cases are. This will be an opportunity to deliver more, rapid testing, not just within County Durham, but right across the country than has actually so far been delivered before. And the Honourable Gentleman may have heard that extra support is being provided to schools and colleges in order to be able to stand up this testing. We are in areas and where schools and colleges have particular problems. We will look at supporting them with a team in order to help get this mass testing up and established. And in terms of the data that is being collected, of course, this is vitally important. So those youngsters who are in a situation who test positive as a result of taking a lateral flow test, that data will be fed immediately into the test and trace system, which of course is shared with local authorities as well.
And now we go to Romsey and Southampton North. Caroline Noakes.
Thank you, Madam Deputy Speaker. Teachers, parents and pupils all need certainty. They need to be able to plan the return to school, prepare for exams if they are going to happen, and they need to know whether they might need additional childcare. I commend my right honourable friend for his ability to make changes when required, but please can he assure my constituents that this is the plan that is going to stick and it's going to give all of them the certainty that they are desperately calling out for.
Well, I certainly hope it does give them confidence, knowing that primary schools in her constituency of Romsey are going to be opening on Monday. Give her the confidence that exam year groups are going to be returning into secondary school, into colleges on the 11th of January, and all year groups will be returning shortly after that.
And we go to Bristol South, to Karen Smith.
Thank you, Madam Deputy Speaker. The Secretary of State has just said that we can be confident about what's happening next week. But frankly, as a parent, as a legislator, I have no confidence in what the Secretary of State has just said. In fact, I am none the wiser after his statement, having heard from experts in health privately this afternoon. Parents have got one question for the Secretary of State. How will we know when we send our kids back to school next week or the week after that it is safe to do so?
Well, what we have seen consistently ever since the start of June is that millions of children have safely returned to school, down and thanks to the amazing efforts of so many teaching staff and support staff, creating safe and secure environments for them to be able to learn in and also for others to work in. But we do recognise with this new strain, we have to go that bit further, so much further. And that is why we're introducing this mass testing scheme, the largest that this country has ever seen, to give parents, to give those who work in secondary schools, extra confidence and extra belief that it is safe for those children to return, but also to help all of those who are engaged in this battle against COVID to be able to root out this disease and make sure those who unfortunately are infected by it are able to know that they're infected by it and are able to self-isolate.
Now we go to Starbridge, to Suzanne Webb.
Thank you, Madam Deputy Speaker. Now, I stand steadfast behind the government in its determination to protect young people's education, and ministers are right when they say it is a national priority. Now, there is a theme to my questions today, and rightly so, as we end what has been a difficult and challenging year for those working on the front line. Will my right honourable friend join me in thanking all those who work in schools in my constituency, from teaching assistants, teachers, the heads of department, heads of schools, those who transport children to school, to those who keep the schools clean and safe, to those in schools who have fed and watered our children, often going above and beyond, doing their utmost to protect our children's education and keep our schools open. We owe them a debt of gratitude.
Well, I would certainly like to join my honourable friend and constituency neighbour in thanking all of those who are working in education settings right across Stourbridge and, of course, right across the country. And, of course, many children in my constituency benefit through travelling into Stourbridge to benefit from some of the brilliant schools that are provided in her constituency. Teachers, support staff have done an amazing job. And, yes, it is true to say that we are asking even more of them, Madam Deputy Speaker. But the reason we're asking them to do more, because we realise and understand how vitally important it is to do absolutely everything possible to keep schools open and ensure children continue to benefit from the education we want to see every child get.
Meg Hillier.
Thank you, Madam Deputy Speaker. We all know, as the Secretary of State said, that children benefit by being in school, and we've seen the gap between those from the richest and the poorest households widen during COVID. His permanent secretary put great store on the tutoring programme when she appeared before the Public Accounts Committee nearly 2 weeks ago. But could you give us an update on that, but also about the steering group in his department that's looking seriously at this issue, at the impact on those more vulnerable pupils, and can he be precise about what he's doing so that gap, which has been narrowing massively in my constituency and some of my excellent schools, isn't going to stay wide and get wider still as we go through and come out of the other side of the pandemic?
She is right to talk passionately about the brilliant schools in her constituency, who we've seen a transformation in schools in London as a result of reforms that were introduced both by this government and changes that were made in the latter part of the last Labour government. And we've seen education as an incredibly powerful tool in terms of closing that attainment gap and that disadvantage gap, and London has been one of those real powers in sort of driving that forward. The national tutoring programme is sort of rolling out very much as planned, and actually we're very pleased with the rollout. We want to see part of a spending review, and I'm sure the Honourable Lady will have noticed we've wanted to have the opportunity of seeing this as not something that just happened for 1 year, but actually happened over multiple years, because we believe that is where the real benefit is going to be had. But I must confess, and I'm a little bit old-fashioned on this, I will constantly do everything I can do, whether it's in her constituency or whether it's in my constituency, to do everything and take quite sort of extraordinary measures to keep schools open wherever it is absolutely possible to do so. And if they do have to close, to make sure that that closure is for the absolute minimum of time, because we do see children suffering as a result of isolation. And I know from both of my children have had to sadly self-isolate as a result of being in contact with other children with COVID. And it's really important, whether it's the national tutoring programme, whether it's the COVID catch-up fund, but whether it is the continued reforms that we've had in education that have driven up standards so much in her constituency and my constituency. We mustn't lose sight that these reforms have to carry on to continue to drive standards and reduce that attainment gap.
Now we go to Rushcliffe. Ruth Edwards.
Thank you, Madam Deputy Speaker. I've been contacted by school leaders who've highlighted their need to get clarity over future changes to school opening arrangements as quickly as possible. Would my right honourable friend consider a suggestion from one deputy head in my constituency? Publishing the real-time data that influences these decisions via an online dashboard similar to the one published by the Department for Health and Social Care, so that schools would have as much time as possible to plan? And would he meet with me and my constituent to discuss this in more detail?
Well, we'd certainly always be more than happy to sort of look at different ways of being able to share as much information as possible with schools and communities about what best informs decisions. The Minister for School Standards, as I just about to leap to my feet, immediately wanted to meet with my honourable friend and her constituent, so I know that he will be organising that swiftly in order to be able to listen in greater detail about the thoughts and ideas, but also not just about the current challenges that school face, but also how we can continue to drive our reforms and improvements within the school system, not just this year, but for decades into the future.
Now we go to Manchester, to Lucy Powell.
Thank you very much, Deputy Speaker. Finally, the Secretary of State has come to Parliament to address the issues that have been swirling around everywhere over Christmas, which began with him ordering schools to go online for the first week of term on the last day of term, having taken legal action against councils that wanted to do the same thing only 3 days earlier. And today he tells us that some primary schools won't open, but he hasn't actually published the list of those schools. This really now is a catalogue of incompetence from this Secretary of State. But after months of asking, he still hasn't answered the critical question of how the differential impact of missing school will be addressed, especially for the most disadvantaged. No word on how exams this year can proceed on a level playing field. So if the test of his legacy is the attainment gap, I'm afraid it's one he's going to totally fail.